I just wanted to ask you, I've been hearing from some community advocates saying that they would like more culturally relevant information and guidance. Fraser Health recently has started some of that by providing guidance on how to wear a mask over certain types of head coverings, for instance. And I'm just wondering if there's been guidance provided to health authorities to get some of this information out there and to, do different types of guidance for different types of groups.
Yes, and that is something that the health authorities do on a regular basis, and really it is very localized because they know their populations best. So the initiative that you're talking about in Fraser Health, there's initiatives that Vancouver Coastal has done with different population groups, and whether it's language groups or ethnic groups and different types of celebrations. So we do some, mostly through the BC CDC and through our provincial communications, but much of that is done at a local level with the local knowledge and populations. And I know there's a number of different languages, at least 14 different ones that I'm aware of, that Fraser and Vancouver Coastal regularly use across BC. But yes, it's a very good point, and we'll try and make sure that we have appropriate things coming for the initiatives that are coming up or the events that are coming up as well to support people.
I think this is a very important point. It was one of the considerations when we initially did our survey of people across BC in multiple languages and got responses from people from communities as to what they wanted to know, what they needed to know, what their assessment was of COVID-19 in the last number of months. I've done a significant number of a significant amount of outreach personally, and I know many others have, to both cultural communities but also to younger people, because I think there's two sets of issues here. One is people perhaps in diverse communities is one set of issues, and the other is people of different ages who have different approaches and get information differently. I dare say, and I hesitate to say this in response to your question, maybe less from television news and more from other sources. So that's what's required. I think what you're going to see, in addition to the other things that we've done, I think the close to a dozen meetings that I've had even in the last week personally and others, that you're going to see a significant campaign to get more of that information out starting early next week as well, in order to get that out, continue to get it out broadly in many diverse communities in BC. I think it's important to do, and it's important to empower leaders in communities, and especially young people in communities, to be able to have their voice heard and to be influencers, to be part of this effort to stop the spread of COVID-19 in BC. So there's significant actions been taken, as Dr. Henry rightly says, and we're going to, I think, be increasing that activity in the days to follow, and we'll have more information for you in the coming few days.